Hi, I'm Linda from English Learning Mind Map. Today, we will learn about precision medicine. Precision medicine. To revolutionize diagnostics and tailor interventions through precision medicine, doctors no longer rely on a one-size-fits-all approach. Basically, we are making medical plans that fit each person's unique body perfectly. Genomic sequencing. As a foundational pillar of precision medicine, genomic sequencing allows scientists to decode blueprints and pinpoint mutations in a patient's DNA. In simple terms, we are reading the instruction manual of the human body to find mistakes. Variant interpretation. Variant interpretation is a critical branch of genomic sequencing used to categorize risks and decipher anomalies in the genetic code. This means we are looking at the differences in a person's DNA to see which ones might make them sick. Pathogenicity assessment. Through detailed pathogenicity assessment, experts in variant interpretation can evaluate virulence and confirm causality for rare diseases. To put it simply, we are making sure that a specific typo in the DNA is actually the reason for the illness. Epigenetic profiling. A secondary focus within genomic sequencing is epigenetic profiling, which helps to track modifications and observe triggers caused by the environment. Essentially, we are seeing how things like diet or stress have changed how our genes behave. Methylation analysis. Methylation analysis is a key tool in epigenetic profiling used to detect markers and predict vulnerability to certain chronic conditions. In other words, we are looking for chemical tags on the DNA that tell us if a disease is starting to develop. Pharmacogenetics. Pharmacogenetics is a vital aspect of precision medicine used to optimize efficacy and mitigate toxicity of common medications. To put it simply, this is the study of how your genes decide if a medicine will work for you or make you feel worse. Drug metabolism. Within the realm of pharmacogenetics, understanding drug metabolism is essential to process compounds and regulate dosage for each individual. Basically, we are checking how fast your body uses up a drug, so we know exactly how much you should take. Enzymatic breakdown. Enzymatic breakdown is the chemical engine of drug metabolism that works to catalyze reactions and facilitate absorption in the liver. In short, we are watching how natural proteins in your body break down the pill so it can enter your bloodstream. Adverse response monitoring. Adverse response monitoring is a safety protocol in pharmacogenetics to identify hypersensitivity and avert complications before they become dangerous. Effectively, we are keeping a close watch to make sure the patient doesn't have a bad allergic reaction to the new treatment. Toxicity screening. Toxicity screening serves as the final check for adverse response monitoring to measure saturation and prevent poisoning from drug buildup. This means we are testing the blood to make sure the medicine isn't becoming toxic because the body can't get rid of it. Biotechnological Innovation. Biotechnological innovation is an advanced field of precision medicine that allows us to engineer solutions and surpass limitations of traditional surgery. In essence, we are using biology and high-tech tools to build new ways to heal the body. Gene editing. Gene editing is a transformative branch of biotechnological innovation used to rewrite sequences and eliminate defects directly in the cells. In other words, we are going inside the body to fix the broken parts of the genetic code. CRISPR Applications. Under the umbrella of gene editing, CRISPR applications allow researchers to target segments and modify traits with incredible precision. To put it simply, we are using a tiny biological tool to cut and paste DNA to cure genetic disorders. Immunotherapy. Immunotherapy is a groundbreaking form of biotechnological innovation used to prime defenses and combat malignancies like advanced cancer. Basically, we are training the body's own immune system to find and kill cancer cells by itself. Monoclonal antibodies. Monoclonal antibodies are the primary tools used in immunotherapy to neutralize pathogens and flag invaders for destruction. This means we are creating special proteins in a lab that act like signs, pointing out the cancer cells so the body can attack them. Clinical informatics. Clinical informatics is the digital backbone of precision medicine used to aggregate data and improve outcomes for entire populations. Simply put, we are using computers and big data to make better decisions for patients. Predictive analytics. Predictive analytics is a powerful module within clinical informatics used to forecast trends and anticipate needs before a patient gets sick. In short, we are using math and history to guess what health problems might happen in the future. Risk stratification. Through risk stratification, predictive analytics can group patients and prioritize care for those at the highest risk of heart failure or stroke. This means using a computer to find the people who need a doctor the most urgently. Telemedicine integration. Telemedicine integration is a modern application of clinical informatics used to bridge distance and expand access to specialists worldwide. Effectively, we are using the internet to let people see a doctor without having to leave their homes. Remote diagnostics. Remote diagnostics is the functional layer of telemedicine integration used to assess virtually and stream vitals like heart rate in real time. To put it simply, we are using digital gadgets to check your health even if you are hundreds of miles away from the hospital. Thanks for watching. Please like and subscribe for more English lessons.